Rubella, also known as German measles or three-day measles, is a contagious viral infection caused by the rubella virus. It is characterized by a distinctive rash, mild fever, and other symptoms. While rubella is typically a mild illness in children and adults, it poses serious risks to pregnant women and their unborn babies. Rubella is transmitted through respiratory droplets when an infected person coughs or sneezes. It can also spread through direct contact with the nasal or throat secretions of an infected person. Individuals with rubella are contagious from about 1 week before the rash appears until about 1 week after the rash develops. Rubella symptoms are generally mild and may begin 2 to 3 weeks after exposure. Common symptoms include rash starts on the face and then spreads to the rest of the body, typically lasts 3 days and is usually not itchy. Fever, mild fever, usually less than 102 degrees Fahrenheit, 38.9 degrees Celsius. Other symptoms, swollen lymph nodes, especially behind the ears and at the back of the neck, runny or stuffy nose, headache, sore throat, joint pain, more common in adults, particularly women. Diagnosis of rubella is primarily clinical, based on the characteristic rash and symptoms. Laboratory tests can confirm the diagnosis, including serology, blood tests to detect rubella-specific IgM antibodies indicating a current infection, or IgG antibodies indicating past infection or vaccination. PCR testing polymerase chain reaction tests can detect viral RNA from a throat swab or urine sample. There is no specific antiviral treatment for rubella. Management focuses on relieving symptoms. Symptomatic relief includes pain relievers such as acetaminophen or ibuprofen for fever and discomfort. Hydration and rest are also important. Infected individuals should stay home and avoid contact with others, especially pregnant women, during the contagious period. The primary method of preventing rubella is through vaccination. The MR vaccine, which stands for measles, mumps and rubella, is typically administered in childhood, usually at ages 12 to 15 months and again at 4 to 6 years. A single dose of the MMR vaccine is approximately 93% effective at preventing rubella, while 2 doses increase effectiveness to about 97%. High vaccination coverage in the community, known as herd immunity, is essential to prevent outbreaks and protect those who cannot be vaccinated, such as infants or individuals with certain medical conditions. Women planning to become pregnant should ensure they are immune to rubella, either through vaccination or previous infection. Rubella is generally mild, however complications can occur, especially in specific populations. In pregnant women, rubella can lead to congenital rubella syndrome or CRS. If a woman contracts rubella during the first trimester of pregnancy, the virus can cross the placenta, leading to serious birth defects, including deafness, heart defects, eye abnormalities like cataracts, and developmental delays. Other rare complications include thrombocytopenic purpura, which is a low platelet count, and encephalitis or inflammation of the brain, though this is rare. Rubella is a contagious viral disease that presents mild symptoms in most individuals but poses significant risks to pregnant women and their unborn children. Vaccination is the most effective way to prevent rubella and its complications. Understanding rubella's symptoms, transmission, and prevention strategies is essential for public health, particularly for protecting vulnerable populations. If there is any suspicion of rubella infection, especially in pregnant women, medical advice should be sought promptly.